we're going to talk about listening in OET. Okay. First of all, are you familiar with the format, with the test format?
Yes.
Yes?
Just a bit, yes.
Okay. Right. To start with, we know that listening has three parts. Okay. Um, in order uh, uh, to succeed in these different parts, you need different skills. Okay. Before we get there, just remember part A is 15 minutes. Okay. Part B is 10 minutes, and part C is 15 minutes. Part A is gap fill. Part B and C are multiple choice questions. Okay. Right. Now, let's see the goals. In part A, which is patient-led dialogue, two patient-led dialogues, you need to understand, interpret, and record detailed content. That is to extract relevant information. So that is detailed content, okay? So we've got three parts. Part A, which is detailed content, okay? So we're looking for details. In part B, which is 6 dialogues or monologues, we listen for gist, detail, and speaker or listener course of action. And what does that mean? What is that? Gist, detail, course of action. Okay. Now, course of action, I'll give you an example. Two speakers talk about something and they agree to do something. And it asks you, okay, what the two people are going to do next. That's an example. Part C are long presentations or interviews with healthcare professionals, and it's 2 of them. And here you listen to identify gist, attitude, and opinion. Okay. So again, we have gist, but here we have something new, attitude and opinion. What does that mean, attitude and opinion? Anyone?
The idea of the speaker
Mm-hmm.
and attitude, maybe about agree or disagree about something,
Okay.
maybe.
So your attitude might be supportive, your attitude might be objective, your attitude might be, for example, funny or maybe basically there is a kind of emotion in it, or there's a kind of a particular sense. Okay. Now, so look at here now, listening part A, which is 15 minutes. And please have a look at this, 15 minutes, 24 items. What does that mean?
You have less than 1 minute for each item.
Okay. And 24, which means how many of the total?
More than half.
More than half. Okay. So the first part has more than half. Okay. We have a problem with part A. A lot of people panic. Okay.
Yeah.
And we don't want that. So I would say don't panic. Okay. If you panic, you lose a few of the questions. Okay, even if you panic, don't actually start crying or don't say, "Oh, I can't do it." Okay, so
Yes.
you might actually lose one, two, three questions. Okay, but do not panic. If you don't know the answer, just skip it. Okay. As you remember, we talked before, some of the questions might not be marked. So if you cannot understand something, just leave it, just skip, go to the next one. And then you can just write whatever you think is correct. Okay. And okay, let's have a look. What sort of questions? It's usually the listening is patient-centered, often a nurse or a doctor. And remember, listening, the same as reading, is the same for all professions. So it's not profession specific. You cannot answer anything with your medical knowledge. It's actually something that you need to hear there. It's usually an accept from extended interaction. So it might be part of a bigger interaction like a consultation, but just part of it. You don't get a structure like symptom diagnosis treatment. It's not a full consultation. And examples, referrals to a specialist, hospital emergency admission, patient retelling their history or treatment or describing a personal matter. Okay. Now, usually you have bullet points and usually you have some uh, cues. So basically, patient's description of symptoms. You see pain located in what should be right here? The location of the pain. Pain described as what? So what should be right? The nature of the pain, okay? Mentions inability to do something. And sensation, so there is a kind of sensation. Occupation, the person's job, okay? So it's not always like this. Most of the time, I mean, they use, so you will get these subheadings most of the time, but sometimes you don't. And that would make the test a little bit more difficult. So uh, you have to pay attention to the type. Um, right. The information is usually paraphrased, but with clear cues for listener. Okay, so maybe you don't exactly hear the pain is located in my tummy, but he actually you can see located, so it actually says that you need to write the location of the pain. Okay, so that the speaker might say, "Oh, well, yeah, um, it started in my tummy." Okay, so doesn't say located. He says it is started in my tummy, but you know that this is the location and you write the location. Okay, so it is paraphrased. And what you need to write here is always heard in recording. It is not implied. So this is very important. Uh, what you're going to write here must be in the recording. So if the patient says, I was short of breath, you say short of breath. Okay? You don't write dyspnea, although it might be correct. But because it is a computer system for, there's a computer system for correction, it doesn't necessarily pick up dyspnea. Okay? And it's always, there's no change in the word form. Okay? You remember in reading we had the same thing. Uh, we usually have the exact. You need to hear the exact word without any change. For example, noun doesn't change to verb, or verb doesn't change to noun or adjective. So it's exactly the same word. And what is interesting here, it says spelling and grammar mistakes are acceptable. Okay, so if you, unless it is actually is totally wrong, it cannot be understood. Okay, so yep, you cannot answer the question as a generic, so it needs to be mentioned by the patient, and it doesn't require any medical knowledge, any specific medical knowledge. Okay, so right. The exam used to be a lot of note taking, but it's now different, and there is now more focus on a patient language. So you will have a lot of people, lay people speaking and non-medical speaking. Okay, and it is designed for specific detail. All right. Any questions here?
No.
Uh,
No.
what about abbreviation, shortness of breath? We can use SOB.
Okay. Well, yeah, no. I mean, if it says SOB, you say SOB. But if it says shortness of breath, or you need to actually write shortness of breath. Okay.
Thank you.
So yeah, if it says if it uses the abbreviation, that's fine. But no, you shouldn't use that. Okay. Right. Okay. Part B.
Okay, sorry. In the, for example, patient's conversation, how many conversation will be with Australian accent that we couldn't understand or listen very well?
Good question. Well, at the moment, this exam is Australian, okay, but what they are trying to do is to introduce more accents, and they're trying to make it more global. But yeah, expect a lot of Australian accent for now. Okay.
Yes, with what with the same speed, because I think Australian is very quick speaking,
It
and we
wouldn't
don't.
it wouldn't be quicker than usual. Okay, it is usually it is the normal speed. These are normal conversations, so it is not quicker.
Okay.
Okay, right. And Australian don't speak faster. They just have a different accent. Okay. For example, instead of they say die. Okay. Instead of way, they say why. But yeah, it's not that difficult. You just need to get used to it. Right. So there's in part B there are 6 items where you need to. Usually there are more gist questions and also detail or course of action, and just 6 items and 6 short dialogues or monologues. So. And this is something fairly new because it was added just a couple of years ago. So what happens here is um, it is 2 colleagues speaking, or a patient, or a carer, or anyone else. So it could be anything. And the scenarios are handover briefings. For example, 2 nurses talking. One of them is handing over a patient, or deciding on a joint course of action. So, for example, 2 junior doctors talking what we should do for this patient. Giving or checking of instructions. So, say, okay, what you need to do to, for example, access to obtain a venous and IV access. Okay, giving feedback to colleagues to tell them, for example, they've done well or they should have done something differently, or addressing patient concerns. So basically, usually they actually ask you, what were these two people doing? Were they deciding on a joint course of action? Or what was this conversation about? It was handover, for example. So these are more like questions of understanding more of the test, more of the conversation. So it tests overall understanding of the audio, and you need to combine the information which is given to you. And sometimes you have inferred views or opinions. So sometimes they can make it difficult, basically. And there are obviously distractors when we have three answers. Okay. And distractors usually are from similar ideas from the same part of the audio, but don't reflect speaker's intention. So they might actually mention writing case notes, prioritizing patients, and dealing with consultants. All of these might be mentioned in the tape, but only one of them actually is correct. Okay. How can they do that? They can say, okay, yeah, there's a session about writing case notes, and the other one, oh, really? I thought it's prioritizing patients. And the other one says, no, I think it's actually it's about dealing with consultants, and those prioritizing patients will be the next session. So basically, they say all of them, but then they say, what does the activity give practice in? So this one is dealing with consultants, right? Also, another testing focus is details. Like they rarely ask you. I mean, they never ask you for factual information like numbers, time, or names. Okay, they actually the questions are in a way that you need to mix the information. You need to again, the same as here. You need to combine the information that is given to you to be able to answer that. Okay. And again, distractors you will have. And so other testing focuses, purpose, function, opinion. Now, for example, it says, it asks, you hear a surgeon talking to his team. Why is he talking to the team? What is the purpose? Okay. And this one, you hear a nurse briefing a colleague at the end of her shift. What is she doing? Okay. So what is the function? Is she advising? Is she telling? Is she warning? Opinion. It focuses on the opinion. So you hear two hospital managers talking about a time management course for staff. The man thinks that few people have shown interest because, okay, that's his opinion, right? Agreement and course of action. So it is it's variable. So there are so many different focuses here. So you hear two colleagues discussing an in-service training event. What do they agree about it? So actually, you need to find out, do they agree or do they disagree? Okay, or if they agree, what they agree on. Okay, and course of action. What are they going to do next? So members of staff wishing to do the course should first do what? Okay. Right. So that's about. You cannot make a guess, basically, and you need to actually understand and combine the information. So there are more gist questions. Okay, it's an entirely new section, and it's there is an increased variety of contexts and voices. This is the place in part B, actually. You might hear more accents because this is a new part. And these have been recorded in the last couple of years. Whereas the older ones are probably from older examinations. So it says a variety of context and voices. So you will have more accents here. Okay. Any question about part B? No. Part C, 12 items. And yeah, and obviously you hear only once. They're not repeated. And there are 2 long presentations or interviews, usually 4.5 to 5 minutes each. And each of them has 6 questions. Right. Most of the time, you will have a monologue and an interview. So they try to give one of each, but not always. Again, there is no, it's not necessarily the case. There is no guarantee. It will express views and opinions rather than facts. Okay. So again, the same way as the reading, you will have questions which are not pure facts. And and these sections are about things like abortion, euthanasia, something which is a little bit of, there's a little bit of controversy. So they talk about controversial matters and discussion, and therefore they're looking for opinions and views. Okay, and also interviews. So it's is a lot about the person who is being interviewed. So the interviewer asks a question, and that is a cue. Okay, that tells you, okay, this is the next question. So usually, if you have 6 questions to answer, there are 6 questions by the interviewer. So and each of them, when you listen, it actually tells you now. With the new question, probably he's going to the next question. And usually these are in the same order, okay? So a lot of people ask me, is it the same order? Yes, usually. We cannot say not necessarily, but the logic says that yes, because the interviewer is asking the questions, that it needs to be the same order. And the monologues are usually, it could be a lecture, a briefing, a training event, just something along those lines. Usually multiple choice question. It's testing gist, attitude, and opinion. And you need comprehension of a large portion of audio. And it won't be simple paraphrase. Now, please pay attention to this. The sentences you will see here will not be necessarily said in the tape. Okay? So you actually need to understand and then understand this as well. So that's why it is a little bit more challenging because they're not using the same words necessarily. Okay. So yeah, there is no simple paraphrase or repeated words from the audio, and you cannot guess. So basically, these are the changes in. I mean, this is the new listening. There are more gist questions, and there are more interviews, and there are questions no longer requiring comprehension of a specific information. So here in part C, you're not supposed to find out any specific information. And students need to listen for deeper meaning of the audio. So they're looking for deeper meaning. So you need to synthesize. Note taking and abbreviation new use no longer required. So it used to be a lot of note taking, not anymore. Right. So the overall system, the overall test, has more voices, approximately 16 voices. It used to be just 3. So there are more voices, more accents, more healthcare contexts. There is increased focus on listening in different ways other than the specific information. And this just workplace listening, less focus on note taking and writing, multiple choice questions, more predictable format. So basically, there is a specific number of questions for each part. Okay, so this means that you will have 24 questions here, 6 here, and 12 here. And that would be exactly the case. Okay. Any problems? Any questions?
Excuse me, doctor.
Yes.
The listening part is the same in all groups. For example, dentists and nurses and doctor are the same.
Yes.
Physiotherapists.
Yes.
Oh,
Yes. It's the
that's
same
fine.
for reading and listening are the same for all the professions. So yeah, dentists, physiotherapists, vet, everybody has the same thing. Okay. Anything else? No
Thanks.
question? Okay. So, part B, you need to remember, you need to synthesize. Okay. So basically combine the information. So distractors are usually part of the conversation. So you might hear all that is written there, but one of them is the answer. Part C is quite challenging because no words are from the audio. So you actually need to pay attention and you need to, and it's more about attitude and opinion, okay? Rather than there's nothing about the detail.